There's no word yet that they've got the 216 votes they need. And joining me from Capitol Hill, Democratic Congressman John Larson of Connecticut. He's the House Democratic Caucus Chair. Thanks so much for joining us, Congressman.
Happy to be here, Chairman.
So let me ask you, you were pretty confident in an interview I just read. You think this is going to get passed. What's behind your confidence? What's fueling the fire for you?
What's fueling the fire is people like Dennis Moore's staffer who called him in the midst of our caucus and relayed a story that's so poignant and heart-rendering that it brought a still to the caucus in terms of the significance and importance, the historic significance of this vote, but more importantly, the impact on people. A 24-year-old woman who's been diagnosed with cancer. Dennis, as you may know, Tamron, is leaving Congress, and so she'll be without a job. And she's not sure whether she can get any insurance or not. That's what this has come down to, a question of whether or not you're on the side of the people or you're on the side of the insurance industry.
Look, Congressman, in our recent poll, the NBC News Wall Street Journal poll, it shows that Americans are split. Even with those heart-wrenching stories that we see that you just mentioned, the numbers show folks are split.
They're split in general when they look at, what's transpired over the last year and all the angst and concern and anxiety and, frankly, the fear. But when you get into the heart of any poll and talk about pre-existing conditions and rescinding of insurance policies and the ability to cap costs and to close the donut hole for the elderly, then the American people are solidly behind us. And what they need is a bill, and what we need is an up or down vote, and that will happen, and we're going to succeed this weekend.
So if your argument is solid and sound, why can't you and others convince members of your own party to vote yes? I mean, we saw Dennis Kucinich, and hang on, before you answer that, let me play how he put it today, his change of heart.
Sure.
I know I have to make a decision, not on the bill as I would like to see it, but as it is. This is not the bill I wanted to support, even as I continue efforts until the last minute to try to modify the bill.
So you hear him there saying it's not a perfect bill, but he will support it. Why haven't we seen more House Democrats who've been wavering do the same thing?
Well, I think we have. I think this is a very private and personal thing, and contacts are being made on a regular basis. I believe that the votes are there. But we have a responsibility to make sure that we give to the members. We're still waiting CBO reports, etc. But I remain confident and optimistic that we have the votes. And I remain so because of people like Tacoma Canfield, who the president talked about the other day. This is what's resonating with the members. And I believe that that's what will carry the day for us. And I feel very confident that we have the votes.
Well, what about these tactical maneuvers that many people are very suspicious of, the deem and pass?
The maneuvers that Newt Gingrich used over 100 times. And
those maneuvers,
these are really not maneuvers. These are just procedures. But again, the procedure that the American people want to see are the procedures that will stop insurance companies from rescinding their policies as they're on their way to the hospital, that will stop insurance companies from pre-existing conditions eliminating their ability to get insurance, that is the cause for more bankruptcies in the United States than anything else.
But the bottom line, sir, you are okay with deem and pass. You're fine with if that turns out to be
Deem and pass is really nothing more than us. If we went to a conference report, right, we would amend that conference report. We would then take the amendment to the floor. In this case, it'll be what we call reconciliation. But again, we get down in the weeds with this stuff. The public doesn't give
the public wants to know, as you said, up or down, what's going to happen here.
Get the job done. What's going to get done is we're going to get this passed on behalf of the American people. It'll be historic in terms of coupling with Social Security and Medicare and now health care under Obama.
Well, we know a lot is at stake for the Democrats because there are many people who question whether or not they can lead and lead together, and we will see what happens in the coming days. Thank you, sir. Greatly appreciate it.
There's a lot at stake for the American people.
And for the party. Thank you.
Thank you.
And we've got some